So I'm going to try to be brief because as a common mentor to some of us here, whenever you suspect you've spoken too much, you've already spoken. So I'm going to be really try to go as fast as possible. First of all, my intention really here is to show how I think we are ready to start colorectal cancer screening in Mexico, and now we're going to try to be smart about it. So first, by ready, we started when we first realized that we needed to have colorectal cancer screening in Mexico. We first started as a group documented the initial experiences in Mexico, and so we identified two initial experiences and helped these clinicians publish their experiences. Then we went out to the field. This work was led by Carla, try to learn what would be the barriers and facilitators in Mexico. And more recently, we piloted to see if we could do population-based screening in Mexico City. Unfortunately, like many projects, COVID hit, so that was unfortunately limited some of our work. But we realized after all this work that colorectal cancer screening was feasible. So then we said, okay, we're going to jump and try to understand whether we can do this in a health system. So we identified a fairly small health system in northern Mexico, but we thought this would be a really good setting to start to understand what would be the challenges, the organizational challenges, and also the in general challenges to implementing a fit-based colorectal cancer screening program in Mexico. So this is the patient flow going from, we started out with 300 individuals whom we started doing outreach to try to get them into this pilot. And I'm not going to go through the detail, but this is a patient flow from outreach and then trying to get them into the clinic to give them the fits, and then identifying how many among those that we gave the fits, we were able to get them back. I mean, this I think exercise, we learned a lot about the system. So really, the work here, this pilot really helped us understand, start working with them, and then helped us start thinking about what would be our next move. So we were able to define, an acceptable and culturally appropriate and feasible program. However, we started thinking about what would be necessary for the next step. And this is where Listos comes in. So after we got, our project really is aimed at adapting EBIs and designing implementations strategies to support those EBIs within this same health system. We will also, through a hybrid 2, evaluate the effectiveness and implementation of our screening program. And finally, and very importantly for policymakers, we will estimate the economic cost associated to implementing a colorectal cancer screening program within this health system. Now, so I think that this exercise that we've been doing over the past 5 years has been very, very useful. And I think that right now we're at a point where we're developing this program within a health system, thinking that this will be transferable to the much bigger healthcare systems in Mexico. Really, the one that we're aiming for is IMSS, which is the Mexican Social Security system. But one of the other parts that I think is really key about working and doing all this process over the past 5 years is that the work has allowed us to have, form a basis for a conversation with organizational and clinical leaders. I mean, just as an example, we now can pretty much have a conversation with them about what are barriers and facilitators to expect if they are planning on developing colorectal cancer screening program, or even start conversations about targeted screening and not thinking about jumping directly into organized. So anyway, I think that this is really key. We need to engage with stakeholders if we're really thinking about scaling. So I think that this just demonstrates that working as a team and can make us not only we're already ready, but now we're going to be smart about how to move forward. Thanks.